Humanitarian crises, whether fueled by conflicts, natural disasters, or pandemics, reach far beyond their immediate physical and social impacts. Perhaps one of the most profound, yet often invisible effects is on mental health. According to the World Health Organization, in such situations, an estimated 1 in 5 individuals will experience a mental health condition such as depression, anxiety, post-traumatic stress disorder, or others. This statistic alone underscores the magnitude of this issue, especially when entire communities face life-altering events. When we break it down, mental health challenges during crises typically fall into 3 distinct categories. First, we have pre-existing conditions. Imagine someone with chronic depression or schizophrenia. These individuals are already vulnerable and may find their conditions worsening when access to care is disrupted. Second, there are emergency-induced issues. These are conditions that emerge directly in response to the event, often manifesting as acute stress reactions, profound grief, or even post-traumatic stress disorder, which we know stems from prolonged exposure to overwhelming trauma. And then there's a third layer, response-induced anxieties. Factors like uncertainty over food and water supplies or confusion about how to access basic humanitarian services create heightened levels of anxiety. Here, it's clear. An inadequate response infrastructure compounds psychological burdens, sometimes creating new layers of mental distress for affected populations. One striking example comes from Pakistan after devastating floods. Communities faced not just food and water shortages, but a challenge that couldn't be seen: psychological distress. Families mourning the loss of homes and loved ones suffered significantly. Imagine this layered trauma, the deep grief of losing family members, combined with coping in unfamiliar refugee shelters, all while trying to figure out how to rebuild their lives. The pressing need for psychosocial support in such moments can't be overstated. Dr. Ahmed Helmel has also shared crucial insights about the long-term effects of trauma. He explains how unresolved mental health impacts often ripple through families, even passing on to future generations. A child growing up in a crisis zone may carry scars from their environment long after the immediate event ends, affecting their development and emotional well-being. This reality is sobering because it tells us that we're not just dealing with individual grief, we're facing the potential for a generational burden. Building sustainable mental health support during humanitarian crises, let's be honest, can feel like an uphill battle. The barriers to care are numerous and often deeply entrenched. First, there's the glaring shortage of trained mental health professionals, especially in regions already vulnerable to crises. For instance, in 80 flood-affected districts of Pakistan, over half were found to lack a single psychiatrist. So, you can picture the challenge of providing care amidst widespread displacement and trauma. Then comes stigma, a weighty obstacle that prevents individuals from seeking help even when services are available. Cultural factors and fears of discrimination often work in tandem, silencing those who most need support. And finally, we have fragmented health systems. You see, when emergency responses prioritize physical injuries and basic needs, mental health easily becomes an afterthought, leaving affected populations without comprehensive care. But it's not all grim. Around the globe, innovative approaches are proving effective in addressing such gaps. Consider the International Rescue Committee's efforts to integrate mental health care into primary health services. They've demonstrated that a cohesive approach benefits not only individuals, but entire communities. Patients are treated in familiar settings, eliminating barriers like stigma and logistical hurdles. A shining example closer to home comes from Dr. Asma Hamayun and her team in Pakistan. They've implemented a tiered system for mental health and psychosocial support, starting with community-level workers trained in psychological first aid. These individuals act as the first line of response in crisis situations, connecting affected persons to more specialized care when needed. The model then scales up to involve primary care physicians and finally mental health specialists for the most severe cases. Another exciting frontier is technology. Digital tools are now being used to bridge human resource gaps and provide scalable mental health solutions. For instance, the Hamar Force initiative in Pakistan relies on a mobile application to connect community mental health workers with supervision and resources they need in real time, while enabling referrals for those requiring further assistance. It's a dynamic approach that combines human compassion with technological precision, and it holds promise for wider implementation in other regions. What's clear is that solving the mental health gaps in humanitarian crises demands both creativity and commitment. These examples, integrating mental health into primary care, building structured community networks, and leveraging technology, represent not only what's possible, but what's necessary to truly address the needs of affected populations. Addressing mental health during humanitarian crises is not just a matter of individual care. It requires community-wide efforts supported by global collaboration. Let's explore how this can work effectively, starting with an important concept: community resilience. In times of crisis, local communities become the first line of support. We've seen this in initiatives like Pakistan's Hamar Force, where everyday people, including teachers, are trained in psychological first aid. This empowers them to provide immediate help, creating a bridge between affected individuals and professional care. Think about it. A teacher trained in psychological first aid can recognize signs of distress in students and provide basic but impactful interventions. These are not fully fledged therapy sessions, but rather the crucial first steps of acknowledging and addressing mental health needs. Importantly, this support not only aids individual recovery, but contributes to a culture where seeking mental health assistance is normalized. Having these embedded, decentralized systems enhances the overall capacity of communities to recover and thrive after crises. On a broader scale, global collaboration accelerates these efforts. Frameworks like the Interagency Standing Committee's Mental Health and Psychosocial Support Guidelines help integrate mental health into emergency response plans, bridging gaps between governments, NGOs, and regional health systems. This structured cooperation ensures that mental health is considered alongside basic needs like food and shelter from the very onset of a crisis. Climate change adds another layer of complexity. Rising temperatures, devastating floods, and wildfires don't just displace populations, they also leave invisible scars. Dr. Nargas Assad has provided crucial insights into how eco-anxiety is impacting youth who've become more acutely aware of their uncertain future. For them, the psychological toll of climate change is deeply intertwined with the physical crises it brings. Women, too, face disproportionate burdens, balancing their roles as caregivers and survivors. In this context, mental health interventions must account for these unique experiences. The key takeaway here is that mental health interventions cannot be an afterthought. Effective responses hinge on a coordinated effort that combines community-based actions with global frameworks. By learning from projects like Hamar Force and following guidelines that prioritize psychological well-being, we can ensure that mental health care becomes a staple part of crisis responses worldwide. More importantly, we can offer survivors not just relief in the moment, but pathways to resilience for the future. And on that note, we come to the end of today's episode. It's been a profound journey exploring such a vital, yet often overlooked topic, mental health during humanitarian crises. I hope this discussion has illuminated the essential role of resilience, innovation, and collaboration in meeting these complex challenges. What's clear is that when we work collectively, combining community energy with global solidarity, there's no limit to how much healing we can bring. Thank you for joining me, and until next time, take care of yourselves and each other.